So I would like to pass it off to our panelists for closing remarks. And before I do that, I'm also putting out a poll to our audience just to see how they've enjoyed the virtual town hall today and whether they'd like to see more open discussions on this topic. So that poll is now available for our online audience, and I would like to pass it off for closing remarks. Why don't we start with you at the end, Cheryl?
This was a very wonderful forum for our panelists to give our view and our society's view on regulation. And I think it's important to get the information out to our members, as well as those who are not members and those of the public who are curious as to why we are pursuing establishment of a regulatory college. And hopefully from further discussions that and further emails that you would like to present to us, that we'll be able to impart our views and our knowledge as to why we think we should be getting a regulatory college as well. And we welcome anything that you would like to say, as well as if we could possibly get the word out to even further all those other people that have not even seen a webinar, but those family and friends who we are all patients in this society for BC Healthcare, and we need to impart the importance of what we're doing.
I think if I can kind of sum this up from my perspective, this is not for the purpose of the members out there of all the organizations that are listening to today's presentation. This is not about questioning the competency of technologists in the healthcare system in British Columbia today. This is all about ensuring the competency of technologists in the healthcare field across British Columbia from here on in. And we think that's a very important issue. It's a big issue. We think it's about having the numbers that allow us to do some healthcare human resource planning in a more effective and proper kind of way than it has been done in the past. We think it's about raising the profile of these professions and letting people know that they are a critically important part of the healthcare system. Without these technologists, patients would not have the diagnoses, they would not have the treatments that they get today, and certainly the doctors would not have their information that they need to make those diagnosis and treatment decisions. We feel we're an incredibly important part of the healthcare system. We feel it should be recognized as such, and we think that a regulatory function of some sort will go a long way to not only ensuring the ongoing competency of these individuals, but also raise the profile of the professions across the province to the point we can deal with some pretty major issues that are out there facing our members across British Columbia today. We ask for your support. If you have any questions, I'm sure all of us around the table in any of our offices would be more than happy to entertain your questions by email or by phone. And we hope that you will support us in this very, very important initiative for the future of our professions.
I think it's very timely that this is Canadian Patient Safety Week. And I would ask that if you do support this initiative, to please go to www.patientsafetyrstbc.com. Do send your letter to the Minister. He has to know that there are people out there that do support this initiative. We know there's support from the public, from our members, and from stakeholders in the system. It's going to do, I think, great things for patient safety. It's also going to do great things for our respective professions. It's time to stand up and be counted. Thank you.
And I'll reiterate what my fellow panelists have said. We definitely are a very critical part of the healthcare profession. We are the silent partner, but I think it's time for us to get our own voice. We are very much healthcare professionals. We are not just trained people that walk around happy to perform tests. We are a vital part. There is no test that a doctor does or orders where we are not involved, regardless whether it's an x-ray, lab work, or some type of cardiac test. And of course there's other technologists that are out there as well that, you know, we are a vital and critical part of. Part of our goal is to make sure, as it has been said, that the patient safety is our #1 priority. We want to make sure that there are qualified people in there, and if we find that there are people that are lacking in their qualifications, that we can do something to help them maintain their job so that they can be confident and competent in doing their job, because medical technology does keep marching forward, And every year there are new changes. We want to make sure that our members are properly educated.